Okay, I got a bad rap a couple years ago because I didn't look at patients' wish pictures. And I can actually remember having some confrontation with the patient as she was asking me, "You mean to tell me you won't look at my wish picture?" And I said, "No, I will not look at your wish picture." And it became this kind of standoff. She ended up not having surgery with me. And to be honest with you, I don't blame her. But let me tell you why I don't look at wish pictures and why I don't think you should look at wish pictures either. I always say to patients, look and find a surgeon whose style you like and go with that surgeon. Don't hone in on one patient and say, I want to look like this, because it's absolutely impossible. And I've written down just off the top of my head 16 differences between people that account for all this variability, which is why it's impossible for you to look at a wish picture and say, I want to look like that. You can have that style, that I totally understand, but it's really difficult to say, why can't I look like that? So let me explain why. So I've just written down a few things here. So for example, let's just start talking about the spine shape. There are patients that can have a very straight spine that goes all the way down their back and kind of goes into their butt. These are people who will say things like, I don't have a butt, I just have a very long back, or I have a crack in my back. Those are very straight. And there are other patients that have a really nice, what we call lordosis, which is that lower part of the spine as it comes towards the butt. That can be really shaped. So there's all different types of variations with that. So if we're looking from the side profile, if you're looking directly at somebody's back, there's very few people that have an exactly straight line down their back. Most people's spine have some degree of movement, and other patients have scoliosis where there's actually quite a bit of movement to the spine. Another thing that we can look at is if we look at the infragluteal crease, or also called the cuff. What is that area under the butt? That is fixed. We can't change where that crease is. It would be like trying to move your arm crease. This is where my arm crease is. It's been like this my whole life. It'll always be like this. So some things are fixed. So that cuff area, you may see somebody in a wish pic that has a really nice cuff and you may want that. You can't get that. You can't create that. You can't make that. And that's just a natural difference. Tissue distensibility, meaning how soft is your tissue. And so for some people, you can inject fat and they get really a lot of projection. And other people, you have a hard time getting projection because their tissue is just very, very strong. It's like a piece of leather. And as you're injecting the fat, you can't get that tissue to distend. Similar kind of feature, skin quality. Some people have really good skin quality. It's very thick. It's very strong, and that can hold the fat, and that can even give somebody more of a lifted appearance than somebody that has a weaker skin quality. You can look at pregnancy status. There's changes to the body that happen after pregnancy. And so there's a difference between somebody who has a BBL after they're pregnant and somebody who has a BBL before they get pregnant. You can look at something which I call vectors. Vectors are the shape relationship between the spine and the butt. And I consider it really a negative vector, a neutral vector, and a positive vector, with those positive vector patients having more projection and in general a better shape than somebody that has a negative vector. Again, something we can't change. Something you can change is internal fat. So that's variable from patient to patient. The amount of internal fat you have. It's another reason why you can't look like a wish pic. If you have more internal fat than the wish pic does, that's a big difference right off the bat. Your height. Obviously, that's a difference between everyone. Your natural waist size. Liposuction can reveal what the waist looks like, but we can't actually change the ribs. And this is the whole concept of waist trainers trying to squeeze the body in to change that. You can't. You can't change your natural waist. All you can do is to lose as much internal fat that you have. That will bring your waist in. But once you don't have any internal fat there, there's nothing that you can do to get a more narrow waist. You can remove the fat on the outside. That's what the liposuction reveals. Once there's no more internal fat, there's no more external fat, that your waist is what your waist is. That's your natural waist. The length of the torso. Some people have a really long torso. Some people have a shorter torso. That can affect how your BBL looks. The height of the butt and the width of the butt are also factors that are fixed, that we cannot change. And you see somebody, oh, I really want to look like that wish picture. Well, if you have a very wide shape to your butt already to begin with, it's very hard to look at a wish pic who somebody's very perky, because perky butts that are really round and have good projection and very spherical and very full, they tend to be narrower butts. So if you have somebody who has a butt that is, this wide on one side, say, it's very difficult to get that person to look perky, because they tend to look more flat, particularly if the tissue distensibility is not there. So the shape of the butt itself, whether it's the height or the width, those impact things. Then we're even getting way more complicated. Look at the actual underlying pelvic shape, the bone. Everyone's pelvis, we're all human, so we have a general shape. But if you look at everybody's face is different because of the underlying bony structure of their face, their skull, their bony, their maxilla, the mandible. All of these things, there's an underlying bony structure that we cannot change. And same thing with your butt. You can have an underlying pelvic shape. Some are more flattering and some are not as flattering. And if you have a not as flattering underlying pelvic shape and you look at a wish picture, I want to look like that, that just, you can't have that. Not only the pelvic shape, the bone, but the muscles that attach to the bone. So all the things that make us be able to walk and run and jump, the gluteal muscles, those are also different shapes. Some people have longer muscles. Some people's attachments are in a little different location. All of these factors together, the skin quality, the fat, the bone, the muscle, all of these things are so, and this is just a touch of the things that we're talking about. All of these things go into making us very unique, completely different individuals. The more you operate, the more you realize how variable we are, how many variable things we have. And that's why just picking somebody off Instagram, looking to say, wow, they look beautiful, I want to look like that. That's why it's just impossible to do that. And that's why I don't look at wish pics. I don't think they're helpful. I actually think they're harmful. I think they can lead somebody down to expect something that they can't get. And that's why I think it's better to just say, look, just look at the general shapes that your surgeon is doing. Do you like them? And if that's the answer, go to that surgeon.